Welcome to the first video on women's mental health. I am Jennifer Schmitz with the Schriever Guardian Resilience Team. The first video is a general overview about our hormones and body image concerns that so many of us experience. Before I launch into this series, let me tell you a bit about me. I have worked with the military for 25 years, mostly in mental health clinics. This position with the Grit has afforded me the opportunity to branch out into coaching and teaching many of the things I have learned over the years, kind of like what I'm doing here. However, I am still a credential provider and can provide therapy in both the RA and clinic settings, from one-on-one to marital counseling for mild symptoms that does not require charting, all the way through to operating as a full mental health provider in the specialty care environment. This may be clear as mud, so please feel free to contact me if you have any questions. If you're not at Schriever, you can still contact me for resources or contact your local mental health providers if you would like to initiate in-person care. So, getting into the topic at hand, know that my approach to mental health is to talk to the person in front of me and get the larger picture of what is going on for them, both in their life and in their mind. Then, work with the individual to figure out what they want to feel and how they want to act. There are so many factors that go into that. Gender is just one. So I have to admit, when I was asked to develop videos on women's specific mental health and then on pregnancy and postpartum, I felt a bit overwhelmed because my opinion, there is very little in mental health that applies to everyone based solely on gender. But if I am honest, there are some generalities that do exist in most categories, such as being male, being female, being pregnant, being in the military, being a parent. The list could go on and on. So I'm going to give this a try. But please understand that many of the things that I say or point out has more to do with generalities and do not accurately reflect the experiences of everyone or every situation. I am going to ask you and your spouse, whether male or female, if you are including them, to take what applies to you and let the rest of what I say go. And my hope is that the part you let go is at least fitting for somebody else. So please don't take offense if you're a female and relate more to how men typically act, more so than the way women typically act, because I have seen all of that too. Given that there are some commonalities in different groups of people, there are still some pretty tried and true ways of looking at yourself and others across multiple domains and topics. I have been developing the general mental health skills library for pretty much everyone, and I'm far from done. I recommend checking out these videos toward developing a better understanding of yourself and what makes you tick. The series provides education and some prompting questions to ask for self-exploration. This is toward the goal of finding ways to feel better and change your behavior. As a therapist, I am aware that I do not have all of the answers. Rather, I see my job as trying to ask the right questions. The right answers come from the person I am talking to. Here, I'm just doing it in a video format. But for right now, I'm going to hit the wave tops on some common themes for women. First, hormones. Everybody's favorite, right? There are so many types of hormones operating in our bodies that do all kinds of amazing things and give us feelings of health and well-being. That is decidedly the good. But when they are not balanced, wow, they are really annoying. That is the bad. Adam put together an amazing video on the intricacies of hormones in the menstrual cycle and implications for pregnancy. And I'm not going to repeat all of his hard work. Rather, I'm going to talk more about how to manage the roller coaster. Although much of this is covered in more depth in the general mental health series of videos as well. But in relation to hormones, I would say, have some compassion for yourself. If you yell at yourself for feeling hormonal, which is totally a subjective term, by the way, you are more likely to increase whatever negative feelings you have, as now you under threat and assault from you. For the vast majority of us, yelling at ourselves makes us feel worse. If you have strong hormonal mood swings, it may be best to let your partner, friends, or family know so that you can talk about it calmly before the mood swing starts. In addition, you may want to track your cycle and your mood so you can see it on paper and make plans on how to manage it month to month. You can come up with ways to change your environment to reduce stress. This is an often overlooked way to manage the hormonal mood swing. The more you shovel into your daily schedule during a mood swing, the more likely the mood swing will be worse. Possible things to do are to decrease social engagements or pause long-term tasks if you can. You might benefit from having increased me time to lower the amount of sensory input on your nervous system. If you can't, you can develop some specific phrases that will cue you or your partner to do things that are helpful rather than causing more strife. There are a lot of additional skills you can use to cognitively and behaviorally mitigate the impact of hormonal fluctuations. And again, a lot of these skills are located in that general mental health Think and Connect video playlist. Communication is key though. There is a good chance those closest to you would be open to talking if you give them the chance. It is better to join forces against the situation rather than fight with each other. I would, however, like to add that hormones are not a legal defense for murder, or hurting people, or even just being mean. They are not even an excuse. We are still responsible for our actions. The good news for this is that you can take responsibility for your actions, which in turn means you have the power to change them, which makes you powerful. As for the ugly, if you find that you are having clinically significant, very severe depression or anxiety symptoms related to your menstrual cycle, like feeling you would be better off dead, can't get off the couch, or so irritable you are hurtful, or it is impacting your job performance, to include the job of being a spouse and/or a parent, I would really consider talking to your primary care provider for medication. Premenstrual dysphoric disorder is a real thing, and if learning new coping skills is not enough, medication could be an option to balance out your system. If you get to the point you are having suicidal ideation, seek medical care ASAP. If it is immediate, call 988 or walk into the mental health clinic during open hours, or go to the emergency department of any hospital. Next big topic is women and our bodies. I think for most women, one of the most complicated, emotional, and sometimes even destructive relationship we will ever have is with our bodies. I could argue it is socially and culturally generated, and I would probably be right. I would like to be angry at all the advertisements that make us feel inferior and trying to take our money to look more like what they say is attractive. I would like to yell at my hips, stomach, crepe, buttocks, arms, or even my toes for not being aesthetically pleasing, or comfortable, or functional, or somehow not good enough. I have gotten very angry, depressed, shamed, all the things, when I think about my body. And while those things have at times been quite helpful in releasing my emotions, they have not overall improved my relationship with my body over time. This includes as my body gets older, or when I asked it to house and grow my 2 boys for 9 months. I'm guessing I'm not the only one having this experience. So, how do we improve our relationship with our bodies? I would say with compassion, awareness, communication, gratitude, and care. So let's explore these. You've probably seen that I often compare our bodies to our vehicles. Our bodies are amazing vehicles, regardless of make or model. They carry around our minds and our souls, but they are not all the same and do not have all the same attributes. I argue this is great, as a world full of sports cars would not be good. Sometimes you need a truck or a minivan. From the female perspective, it is not uncommon to have always wanted to have a slight, light, agile ballerina body, or that of a muscular softball player. But instead, you were born with a different body. Perhaps you were born with a big boned body type instead of that of a supermodel body type. So as I mentioned, treating our bodies with compassion and gratitude for the work they do to better our lives is quite important. If we live with constant battering ourselves for not being born with a different body, if we continue to hate on our bodies for not being or doing something else, we will develop more and more hate and despair, which will increase the level of threat that we feel, which will increase our cortisol, or the stress hormone, which will make us more depressed or anxious, which may lead us to not taking good care of our bodies with activity and good food, which could lead to feeling unhealthy and powerless, which will worsen our thoughts about our bodies. And then the cycle goes on, getting bigger and more negatively impactful on life until we have a full-blown disorder. It is a miserable cycle aimed at an overall amazing piece of machinery. It's not fair. This is one important reason why I stress gratitude and acceptance for what our bodies presently do so well, with encouragement and compassion to do things that will make our bodies feel even better. I talk a lot about falling into the societal traps on how our bodies should look and perform. I think these traps really have more to do with giving to others, either by giving them our money for their products or by giving them our views or likes on social media to make them feel good. If you are genuinely changing your viewpoints and behaviors related to your body from a place of caring rather than hating on your body, you will likely be more successful. Giving it enough sleep, activity, and nutrition is done with care and appreciation, and not with hate and annoyance. I do appreciate there are times that acceptance can be more challenging than other times. Getting seriously ill or having an injury or having a disability are good examples. Here, determining your values, the attitude you want to approach life with, is important to know, so you can approach your life and your body from what it can do rather than overly focused on what it can't. I am making a video on radical acceptance, so stay tuned to learn more about this. The next important aspect of building a positive relationship with our bodies is recognizing and paying attention to its signals. Here I advocate for the use of mindfulness in its truest form. Overall, many of us have the tendency to dissociate from our bodies and spend most of the time in our heads. So what is mindfulness? It is intentionally living with awareness in the present moment. It is sitting in the present moment without judging or rejecting the moment. And it is doing so without attachment to the moment, not worrying about the past or am I never going to experience this again. So let me give you an example. Imagine you are riding a roller coaster. Mindfulness would be experiencing the drop in your stomach on the hills, the wind in your hair, the surprise at a turn, and what your body, mind, and soul are experiencing in the moment. In the same example, the opposite of mindfulness would be riding the ride, thinking about work, thinking about what you're going to do after the ride is over, worrying that you may not ever get to ride a coaster again. Basically, missing the ride itself. In relationship to our bodies, we can be so busy thinking or saying to ourselves, I will appreciate my body when it is fill in the blank. Until then, I'm not really going to pay attention to it or enjoy it until it submits to my will. I would argue being aware of the things your body is trying to communicate by practicing mindfulness is the first step, but not the last. So, how can you start practicing mindfulness? This may sound odd, but one of my favorite examples is to envision yourself as a child, experiencing whatever sensation for the first time. Think of a baby's first experience with ice cream. You can see them trying to figure it out, looking at it, touching it, tasting it, how it feels in their mouth and then in their body. They are totally into that moment. It is cold, it is sweet, it is slimy. Then they're totally into the next moment. Maybe now it's sticky, and then the next moment. Now they are full and ready to move on to something else, even if they didn't eat the whole thing. And it continues on and on. You can do this with other activities such as swimming, lying on a bed, or washing your hands. There is a term called flow state, which is the intense mental state in which a person becomes fully immersed in an activity. It's a feeling of energized focus, concentration, and enjoyment. Some people also refer to this as being locked in. This is a great way to think of mindfulness, even if it is only for a couple of seconds, multiple times a day. It can be helpful. You can also practice mindfulness with a thought that may occur to you. You notice it, and you notice what body sensations accompany it. You can observe all the thoughts coming and going from your mind as if you're a spectator at a marathon race. The thought comes like the runners on the course. They run by you, they continue on, and then ultimately you lose sight of them. You let them go. I do appreciate with some thoughts, the temptation is to jump in front of it on the running course and try to tackle it to the ground. This is a habit. Once you realize you are in that struggle, you go back to letting the thought go without judgment. This takes practice, lots of practice. So be patient with yourself. If you have trouble, come see me or a mental health professional, and we can coach you through it. I do feel compelled to add that most of us have been trained not to practice mindfulness. Unlike the little guy with the ice cream cone, we have been programmed to keep things neat and moving forward. Keep things under control to include our minds. We are often programmed to be goal-oriented. I want to emphasize that this is not bad. There is a time and place for that pattern. But if you want to build a better relationship with your body, you can take a few instances a day to be aware of your body. Even using this technique when you are walking to your car will help. You won't do it all the time. It will take some practice to develop mindfulness as a new habit. And you can do it while being neat or keeping things organized. Just notice what you feel and think, whatever it is you are doing. This can strengthen a good working relationship with your body as your body is interacting with its environment. Again, I encourage lots of compassion and patience with yourself as you begin this new way. Your journey is your journey and does not need to be compared to the journey of others. I'm going to take a minute to talk about symptoms. Symptoms are indicators that something is out of balance. Symptoms could be pain, fatigue, insomnia, disinterest, isolation, many things. It is one form of communication our body has with our minds. There are many physical symptoms we can pay attention to that come along with a depressed or anxious mood. This graphic shows just a few as an example. Symptoms are telling us that something needs attention in order to bring balance and harmony back to our bodies and minds. Symptoms at their core are trying to be helpful. They are just not all equally gifted in how they present the help. Our bodies and minds need maintenance. Many of us are more apt to take better care of our cars than ourselves. We can dissociate from our bodies and live in our very busy minds, which can produce wear and tear on both our bodies and our minds. When we were young, it was like having a new vehicle that could go and go. As it ages, or as we ask a lot of it, our vehicles don't run as smoothly. Many of us will view this need for more TLC as a character flaw and try to fight through these mind-body needs, thinking if I just had a stronger will, I could do everything the way I used to. This sets up an internal fight, which increases stress and makes the symptoms worse. Listening to what our bodies and minds are trying to tell us they need is as important as regular maintenance to a car. Mindfulness helps us with awareness of our inner check engine lights and what needs attention. So in closing, I'm going to double down on what I believe are the core components of optimal maintenance for our bodies and our minds and souls by extension. This is being aware of what our bodies are experiencing, also known as mindfulness, or another way of looking at it is the communication that our body is having with us, but working on doing so without judgment. Next is compassion, that our bodies are working toward goals, and then having gratitude for everything it already does so well. Lastly, providing nice self-care to include nutrition, sleep, medical care, exercise, and rest. So as always, if you have questions or comments, feel free to let me know, and I'll see you in the next video.